Hello, everyone, and welcome back to part 3 of Shanita's endometriosis journey. And we'll jump right in to the questions. How was your mental health throughout your journey?
So, in terms of mental health, I would say that I was depressed. It wasn't full blown depression or the the definition of depression, but I would say that I was experiencing some depression because as I mentioned before, had excruciating pain, and to just explain or give an explanation of what our description of the type of pain I felt, it almost felt like barbed wire. During the times when I had my period, it would feel like barbed wire, or it would feel like a knife was being carved inside of me somewhere, or it would feel like I was being punched in my stomach, my abdomen. It would even feel like contractions. It would feel like whatever painful thing you come up with is possibly what I felt during that time period. And this was on a every month basis. So it was not easy, and knowing that I was going to experience this every month caused me anxiety. It caused me There was even a time when it caused me a panic attack. Um and I had to At the time my ex-husband was there, and he had to call the ambulance because for some reason I just thought I could not breathe. And when the ambulance came, they were like, "Oh, the paramedics came. They said, oh, you're breathing fine, whatever." But they still took me to the hospital that time. And they also caused me. There were times when I wouldn't call them suicidal thoughts, but there were times when I felt like I literally just needed to take out whatever area it was that was causing me pain. It was just that bad. And along with that, also knowing around the time when my stomach started to grow because of the blood, um, knowing that the look of that also caused me to feel horrible. As my sister would say, I had body what do you call it now? Dysphoria? Anywho.
No, it was disturbed body image.
Okay. And that was because I was losing weight, and I lost so much weight. So much weight I lost. I was very, very skinny, and I still had a humongous stomach. It was very bloated. So it was just everything all together, the pain, the way that I was looking, and the anxiety, the fatigue. I was constantly tired. And meanwhile, during this time period, I was still going to work. I was still going to school. I was still living life despite having all of these issues. I wasn't bedridden except for my two worst days of the month. I would be bedridden. And if my two worst days fell during the week, then I would just take those 2 days off, which I had to provide a doctor's note and all of that. And I still got issues from my workplace because, you know, they want to know more, and they want to know more, and they want to know more. Ridiculous. But um, I had no choice because I was pretty much bedridden for those worst 2 days of the month. Um, and so I had to basically be down and out during that time period. But other than that, I was living my life as usual, even while experiencing pain and discomfort. So having all of these symptoms together, of course I felt depressed. Of course I felt uh, uncomfortable, and all the other worst things you could possibly think to feel.
Okay, just want to add to that. When you have a family member in so much pain, excruciating pain, it also affects the family member as well mentally, because it's like you start to get anxiety too. You look forward to the period. You literally have to prepare for period time, and it was challenging. Even when she spoke about her disturbed body image, she would literally go into the mirror every single day and just look at herself and be like, oh, I getting skinnier, oh, my belly getting bigger. And it used to affect me mentally too. I used to get anxiety from actually watching her do that because it was painful for her. And obviously she's my sister and we rolled in the same mother's belly as we would sit back home, and it affected me too. So those are stuff that family members also go through, and I just wanted to add that there. So what organs were cut out, or did you lose any?
So I actually lost our uh what is what I want to say. I actually lost our a lot of organs were actually cut. And to start off with the areas that were cut, I would say my colon was cut. My um I'm not gonna call every area that was cut, but my colon was cut, my diaphragm was cut, my lungs were cut because these are the areas that the endometriosis affected. Um, my navel was cut out, so I no longer have a navel because the endometriosis affected that area so badly. I had to remove that area. My appendix was cut out. I don't think the appendix was directly affected by the endometriosis, but because of the situation, it was. My doctor explained that it was better for having it removed. Um,
It will limit the risk for appendicitis.
Appendicitis. So that was removed, um, along with my ovary, one ovary, and my fallopian tubes, and yeah, and other areas were also removed as well. Not much. Most I would say mostly things were cut, more so than removed. So so yeah, so those were the areas, the organs that were cut and that I lost. I think out of everything, I think that my navel took me a bit of time to actually get used to because obviously I've always had a navel. So every time, I look down, I'm like, oh, I think I'm getting used to it now. It's been 2 years since this whole situation. But every time I look, so now I'm getting used to it now. But before when I used to look, I was like, oh, I used to have a navel, now I don't have one. But yeah, but I still was able to retain a lot of organs as well. Um, so a lot of my reproductive organs are still there, just in case that's a question people might want to know. And yeah, that's pretty much it.
Um, I would just like to say something in regards to that, but about the naval situation. Um, so anytime you lose a part, you're going to grieve over it. Your body parts is a normal process and is nothing to be ashamed about. You might tell yourself, "Oh, the navel doesn't have really a purpose," but the thing is, it was a part of your body, so it will affect you mentally. Um, Even because people like to wear belly outs and stuff like that, so those are things that you're gonna look for when you're doing a belly out or whatever. So it's just a loss, and you grieve over it, and then when is your time to get over it, then is your time. So it's nothing to be ashamed about, and I'm glad Shanita shared that.
And then also some people when they like Tony said it's a minor, it might seem minor, it's not necessarily minor to me. Like she said, it's a part of my body. Obviously, other people have lost bigger organs such as a leg and hands and different things. But in terms of uh, the disturbed, I think the disturbed body image for the navel, I don't think I have a disturbed body image. I have a lot of scars around my abdomen, but they're very tiny, not completely noticeable because I had a laparoscopic surgery, so it wasn't very noticeable. But even if there were, it was a big deal. It doesn't matter. But also, what was I gonna say now? But also, in terms of my navel, I think my doctors did a great job because it doesn't even look like my navel has been cut unless you literally look close at it. They did a really good job bringing it, sewing it back together or whatever. And obviously, I have this scar there where my navel was, but unless I actually uh, wear uh, um, wear Unless I actually like wear a belly out, as Tony said, or something, it wouldn't be noticeable. But I am not ashamed of that either. I think we all have our um, areas that we've had to work on or something. I don't think it's nothing to be ashamed of if you had to get surgery done for whatever reason. It just shows that you have a story. It shows that you've been through something.
Exactly. Your scars are your stories, they say. And our final question is, who were your support systems throughout this time?
So, support systems, I had a pretty big support system. First of all, I would have to say that my biggest support system was my sister because she lives with me, but she actually lived with me coming on towards the last couple of years of my surgery. I mean, not my surgery, my disease. My ex-husband was there in the first stages, and he played a really big part in helping me out with my illness. So I don't ever despite the fact that we're not together or whatever. I don't forget when people do good things, and so he was really there to encourage me. He took me to my doctor's appointments. He changed my bag when I had my pee bag, as people would say, or whatever. When I had that, and he definitely played a big part in the beginning stages of the time when I had, I would say probably the first uh, year one to year 4 or 5, year 5, I guess. He was there at that time. And then afterwards, when my sister came, she also played a very big part. Um, it was frustrating for her, as she mentioned before, especially when she had to cut me meals and I didn't really eat because I couldn't eat. But she didn't really understand that a lot because you know she wasn't going through it, but obviously I couldn't eat for obvious reasons. But she was there with me. She went to the hospital every single time that I was sick, even calling in to work to assist me to go to the hospital. Not really assist wasn't the word I was looking for. I think what's the word I'm looking for?
Like to I was there like to be a support system.
Right, to be a support system with me. But I was very sick, so she definitely had to come in with me as well. Um, my mom played a humongous role during the time when I had my huge surgery. My mother was there with me throughout the entire time. From the first day I had my surgery, that was the last surgery I had, up until the time when I came out the hospital the second time around, and she was there throughout the entire stage. She actually did not leave my side. She slept at the hospital, and the nurses were literally like impressed because she took such great care of me during that time, helping out the nurses, being there by my side, etc. And my dad also came in the second week that I the second not week but the second time that I was in the hospital. He also came to the hospital to spend time as well with me there. Tony had to work, but she was in and out the hospital, and she literally was a great I was about to say asset. I don't want to make it sound like a job, but she was actually a great being there because she, as a medical person, a nurse, she was able to lend her medical expertise, and she actually, the first time that I was in the first week that I was in the hospital for that big surgery, there was something that had gone wrong, and she actually made it clear to the nurse and the other people that what was happening wasn't good. I think it was some tube. As I said, I had so much tubes coming out of me. One of the tubes was not filling up how it was supposed to fill up, or something like that. And she spoke about it, and she got that rectified, and they rectified it in the end because they recognized what she was saying. I remember one of the doctors asking Tony if she was a doctor when she came in because she was so medically knowledgeable. Um, so she did great. advocating for her sister as well while I was in pain. Of course, I'm an advocate for myself as well, and I don't joke like that when it comes to my health. And my mother was also an advocate, asking about medications. Whenever the nurses were about to give me medications, my mother would ask, "Was that medication?" Making sure that they knew what they were giving me. And I think that's a big, 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 big important part of healthcare with your loved ones. Make sure you find out what these nurses are giving you. I'm not downplaying the nurses, but I also know that nurses work really hard, really long hours. Sometimes they have sleepless nights. Sometimes they don't have, they don't get enough food during the day because they're on their feet constantly, and it's easy to make an error. So I think that it's important that whenever you're getting meds, that you ask the nurses, like, what is that medication that you're giving me? Nothing is wrong with saying that. Is to make sure. It might even jog their memory in case, they shouldn't be making mistakes, but things happen. So just to make sure you ask. And then I would also say another big support system for me was was my church family, who prayed for me consistently during that time period. Um, and they were there to also give me a supportive and encouraging word. And then another support system that I had as well was my boyfriend, who also wasn't there physically in the last stages, obviously, but he he wasn't there physically, but he called in to make sure that I was okay, especially during the time when I was going for the surgery. He made sure that, everything was going well. He checked in, checked up, etc. And the last support surgery I can really support system, sorry, that I can speak about is support groups that I join on Facebook and so on. Hearing other people's experience, and listening to other people who are going through the same thing as me or even different from me, and understanding how they dealt with it, listening to medical professionals on these same support groups, understanding what people were doing to ease the pain, the diet changes, the medications, the herbal remedies, the naturopathic remedies that people were using. All these different things came into play. For me, I actually had a naturopathic doctor as well at one point. I used herbs, and it was a whole long down, thing. But all these people in these support groups played a, a, um, a big role in helping me to get through the disease as I was going through it.
So, any last thoughts?
So for last thoughts, as another support system I forgot to mention as well is my extended family. I didn't really think about that as family. I'm thinking about family, but true, my extended family, who are also not here in Canada with me, but are in Barbados, and they were a very, very integral part of my journey as well, because they encouraged me, they prayed for me, they were there to check up on me as well. Despite the thing is, a lot of my family aren't here in Canada, like my grandmother, my aunts, uncles, etc. But cousins, etc. I do have some aunts and uncles here, and cousins and stuff too, but majority of them are back in my country, and they definitely showed support by asking and making sure that I was good and everything.
Any last thoughts?
So for last thoughts, what I would have to say is that this disease, endometriosis, as I said, is a holistic, whole body disease, and it affects people differently. Some people might have had the same symptoms as me. Some of the symptoms I didn't include for me was people say they have pain while pooping. I didn't really experience that much except for like the last couple of times when I couldn't really pass gas and stuff because of the blockages and stuff. But before that, I didn't really have that issue. Other people say they have, pain and excruciating pain when being sexually active. I never had that issue as well. So every single symptom I did not experience, and your symptoms might be different from my symptoms. That does not mean that your symptoms are invalid. Also, some people experience mild pain to excruciating pain, and at different levels. Um, my endometriosis was at stage 4, and it was also a rare form of endometriosis. Other people experience excruciating pain from stage 1 to stage 4. Some people don't experience pain and have stage 1 to stage 4 endometriosis. So everybody's symptoms are different, everybody's experience is different. Regardless, you know if you have the disease, you know what you're going through with this disease. And what I would say is do not let anybody downplay your experience, even for those people that do not have any symptoms, because there are people with endometriosis that don't have symptoms, and the only time they find out they have endometriosis is when they're trying to conceive a child. And again, don't let anybody say, oh, because you didn't experience this or you didn't have this, that your experience does not matter. Um, every single case of endometriosis matters, whether your symptoms may be different or not. Another thing I would say is also always um, advocate for yourself. Do not let anybody downplay what you are feeling. Only you as the patient know what you are going through. Only you as the patient know what you're experiencing. Doctors and nurses can say, oh, your tests are clear, so you're good. No, that's not what it means. It just means they haven't found it yet. So keep pushing, and if that means finding a different doctor or a different medical provider, then find a different medical provider, because you know your body best. Simple. They don't know because they're not experiencing it. And if you're fortunate enough to have a nurse or a doctor that has endometriosis, then of course they might see it differently than those who don't have it. But the point is, everybody needs to be there for somebody else. Another point I would say is that endometriosis needs to be, it is getting more and more out there, which I'm very grateful for, but it needs to be pushed further, because I feel like endometriosis is one of the most painful diseases of all the diseases out there. It's up there in terms of symptoms, fatigue, bloating, and this disease also causes other diseases. All the diseases right now coming to my head, but it causes a whole lot of diseases. But I just think that it needs a lot more exposure, because a lot of people suffer from this illness. And yes, even though more and more people are speaking out about it, there's some people out there that still don't even recognize that they have it. So the more it is spread, the better it is for people to know that, okay, this is what I have. Painful periods are not normal, and also extreme bleeding is not normal. That's another thing they didn't speak about, and that was not an issue for me either. I didn't have extreme bleeding. I bled normally. I had a 5-day period, as I mentioned before, and so my periods were normal. The only thing that was not normal about my period was the pain, and that's what made me realize that something was wrong. But some people also have extreme bleeding, and that's another issue as well. So regardless of whatever the symptoms are, whatever you're experiencing, check it up, and also advocate for your health. And that's about it for me. For what was the question again? For my last
thoughts. Right. You have many last thoughts.
Right. So that's about it for me, for my last thoughts. And I'm also grateful So God, first and foremost, for getting me through this, but I'm also grateful to my family members and so on, all those people that I called that also helped me to get through this process, along with the doctors and the nurses that was there by my side. My experience at the hospital, the last time I was at the hospital, was amazing because my nurses and doctors were, but especially my nurses, were extremely amazing. They were there for me right through.
On behalf of the nurses, you're welcome.
So, thank you for watching this video. Again, if you have any if you have any thoughts, comments, and like, share, and subscribe.
Until next, until next time. Bye bye.
Bye.